Yeah, no, thank you. Thank you so much for letting me be here. I'm excited to kind of talk to you guys about setting up VR labs. That's one of my specialties. That's kind of how I got started in all this space, and I'll kind of go from there. If you have questions, definitely raise your hand. Sometimes I don't know if they wait to, you guys wait to the end, but it's always, questions are great. So just keep them coming. But so, like Julie said, a little bit about me. I have about 20 years in technology. I started off in instructional technology, and I have gone through a lot of jobs. So, like we all have. Oh, somebody's really loud. Sorry. But the last about 10 years I've been in immersive technologies. So I started kind of back in the healthcare field. My aha moment, like I said today on a meeting, my aha moment was I was taking a 360 video tour of an ag facility, and I showed it to kids, and it was just like this eye-opening moment. And so something that I was like, this is something I want to do for the rest of my life. So it was just kind of that moment, and then it just kind of went crazy from there after I started sharing some things and started getting interested in this stuff. So I'm a native Nebraskan, so a lot of people are like, "Whoa, where's Nebraska?" We are struggling right now to get kind of this technology in our state, but we're hoping to, move past that or whatever. So I've kind of started more in the world, and then came back to Nebraska and started helping education with that. So introduction, obviously, everyone in here understands what virtual reality is. So I won't go into a lot of that. It's super helpful in the medical education world or in the nursing education world. When I first started working for University of Nebraska Medical Center, they wanted a way for their students to get immersive learning without actually having to be in a clinical setting. We didn't have a lot of clinical kind of internships at the time. Some of our hospitals had kind of shut down, having outside students in, and there were a lot of students going to one hospital, and they just didn't have clinical times for everyone. And so this was a way that we thought we could, add that additional real life kind of feeling scenario. And at the time, there were only 6 companies that were currently doing this for the healthcare world. There were tons of metaverse, and there was, that was a hot topic, and VR was just such a big thing at that time. And so we, vetted all those companies and ended up going with one company that I think really has done a very good job since then. But here are some reasons why I think all healthcare solutions should, or healthcare industry or medical schools or nursing schools should have virtual reality or mixed reality now. But, providing access, and I'll kind of talk about the different things as far as like cost analysis and why it's important and how much money you can save, even if it costs some money up front, what it can save in the long run. Improving retention and knowledge. We've gone through a lot of different, I've worked for a lot of different colleges and universities who've, asked their former students, hey, how did this help you? And a lot of students come back and they're like, we implemented virtual reality at our healthcare facility. So it's rubbing off, which is fantastic, because now we're starting to see healthcare facilities actually buying the headsets for nursing, retention of knowledge and skills, but also for having, if they need a mental break, having, just a little relaxation app. And it doesn't have to be in VR. It's also in a web app or, iPhone apps, a lot of different apps that you can use, or WebEx. So that's just the different things. Our next generation is already utilizing this. So I have a lot of K-12 that is already using it. So to put it into colleges and universities is the smart way to go. And then eventually, obviously, in healthcare. What questions should you ask yourself, before building a VR lab, or an XR lab? I have had a lot of people come to me and they're like, well, we know we need this. A lot of people in healthcare long ago, simulation mannequins cost a lot of money. They're just prepared to spend a lot of money. So they think if they go and they talk to one designer and they cost $1 million, that they have to spend $1 million. Not everything is like that. Especially these solutions that are off the shelf, they aren't, costing $1 million. Now, if you want to build your own and it's like very in-depth data analytics, you want AI built in, obviously it's going to cost a little more than, the $10,000 to $20,000 for just a basic scenario. But you need to definitely look at cost. You need to look at why you're actually doing this. Are you just doing this because you're tired of mannequins, or are you doing this because you really think you have a need of students seeing real patient issues that maybe they won't see in the real world? You really need to ask yourself those questions. Funding, obviously, and I'll go kind of over funding and where you can get it, and some other examples of how, you can either charge students, that kind of thing. Do you have grants? Do you have external funding, private donors, that kind of thing? And then support. So the 3 key factors for support is administrator buy-in, which is very hard to get, I understand. You always have champions. So usually your champions are like your nursing instructors or your faculty, and they're like, yeah, we're so excited about this, we want to do it. And then you run into a roadblock because maybe your administrator doesn't understand why you need it. And so we kind of help you, prepare that kind of stuff, or, finding a coach or a consultant. A lot of people in the space have already done this. There's a lot of champions out there that have, admin approval, and they found funding, and they're willing to help you. I know a lot of these people in the space. If you ever need someone like that, definitely reach out. There's just, I think people after my own heart, we want to do this. We're all been in education, and we want to do this for cheap, or the most cost-effective solution. And so, we're always we always want to support that. The other thing is technology support. Whatever you do, if you're starting with this and you're trying to do this, definitely involve your IT right away. So I've had a lot of colleges and universities who come to me and they're like, well, we bought all this stuff and we bought a software, but we didn't know we needed headsets. And then they're like, we also didn't know we needed Wi-Fi. And now our Wi-Fi is not strong enough and we have no money to buy headsets. So, definitely talking to your technology department about whether or not, Wi-Fi is a good idea is a benefit. Just having them on board is fantastic. And more than likely, someone in your technology group is like, yeah, I can't wait. I want to be on VR. That's so cool to them. So definitely have them involved. Obviously, you want to find the right hardware and software packages. You don't want to just like buy whatever you think is, whatever's the most expensive. A lot of times in healthcare, whatever the most expensive is supposedly the best. That doesn't apply in VR. It's kind of more of like what you want your students to learn and what you're teaching at the time. Obviously, you need to know how many students, because a lot of these software off-the-shelf companies, it's per license fee. So definitely kind of figure that all out before you're starting this process. Why build a VR lab? So a lot of schools think, oh gosh, I have to build a new building. You do not have to build a new building. You really don't need that much space. As you can see, my niece here is not even in kindergarten yet, and she is looking at a world where sharks are. And so, it's a very safe environment. I don't recommend it for someone under, 6. But, her brother gets into it, so then she wants to get into it as well. But, you're accessing rare resources. So I had my favorite story of VR in the medical world is the person who identified monkeypox at one of the facilities, actually had never seen it in person, and he hadn't really learned about it. He happened to see it in a VR setting. So this was a story that someone else told me. I didn't hear this firsthand. So whether it's true, is up to you, but or probably can be researched. But I think, being able to see something that you may never come across. So for example, sepsis is a huge one. It kills a lot of people. You can't really see it in their field, or most students won't see it. And so it's something that if you know the signs to look for, it's something that is a very useful tool. And so there's a lot of now sepsis simulations out there that are training people how to identify sepsis, which I think is a huge issue in the world. So obviously, next generation is already using it. So for VR lab area recommendations, VR, XR, really VR, you need a 10 by 10 space. The minimal is an 8 by 8 space. I've used hospital hallways. We've taken chairs out of waiting rooms, taking chairs out of small nurses' offices, just so that they could have space to do this. So like I said, you do not have to build a building specifically for this. Now people are starting to build buildings with this. I get questions all the time from universities and colleges who are like, well, we have these mannequins, what do we do with them? Never throw them away, never get rid of them. I don't think that this is something that will replace that. I think it's something that's in addition to that. If you already have those mannequins, that's great. Keep them. VR Patients actually just came out with their augmented reality spatial computing overlay from that you can lay on top of a mannequin that you already have, or a bed that you already have. And it's a fantastic application. I think we'll start moving that way, especially with the Quest 3 and the Apple Vision Pro. I think that's a useful tool to be able to use stuff that you may already have, or actual physical objects in the world, to be able to use both mixed and virtual. So just be kind of aware of that. But I always recommend a 10 by 10 space, especially with some of these companies. You definitely need that. Sometimes you need bigger, like 23 by 16 spaces. Just depends on the scenario. So just know that I have colleges who clear out entire conference rooms, like big, 150 person rooms, just to do VR. So I don't recommend outside unless it's kind of dark outside, or if you have an area tent. Obviously your headsets can get damaged, so try not to do it outside. That's not a benefit. So here are different lab examples. So we have a tractor safe ATV safety that I worked with on the College of Nursing. And this kid on the right, my right, is driving the tractor. So he obviously is sitting down. We don't want, if you're in a moving vehicle, you obviously do not want to be standing. It makes you very nauseous. This top middle is Ohio State. They actually have Oxford Medical in this simulation. This is also, the top left is also Ohio State. So they have markings on the floor. They're 8 by 8 space or 10 by 10 space. They put an X in the middle, and that's a way that they can be in the headset. They don't feel like they don't get sick. They're not standing, they're sitting, but then they have a standing avatar. And so it just depends on your medical simulation application, whether or not you can be sitting, or you actually are walking around the patient bed. So such as Simex is a very different one. You need to be able to be moving and walking around, so you need nothing in that space. I have done, like for Simex's, we have a patient bed that we cannot move out of a room, and we actually position the headset around the bed or through the bed, so that the first time we ever did a simulation, it was classic. I had a nursing student who leaned on the bed, but the bed wasn't actually there, and so they about fell over. We don't recommend that nursing students lean on the bed. You shouldn't be leaning on the bed, but tons of them, that's just something in their muscle memory, and they're like, oh, well, it's not actually there. So then we actually moved the patient bed back so that they could lean against it. So they at least had some kind of real feeling that it was a patient bed. So definitely, explore those options. We actually made our own cart, and I'll kind of talk about this in the end. We actually did not buy a cart. I don't necessarily recommend that unless you're like moving them from space to space to space. We actually just used a file cart, and then drilled holes in the back and put, it ended up costing, I think, like $200, and then put like electrical cords through the back and plugged it in. But we originally purchased the charger stations for the Oculus Quest 1s. We ended up not using those. We just plug them into the wall and like have backup batteries. So just be aware that you don't need to have, it can cost only $200, or it can cost under $1,000. It doesn't need to be these like $15,000 carts that, look all fancy or whatever. If you have the money, great, but most people don't. So just if you want the schematics for that, I can help you with that. But this is, again, the tractor safety. Obviously, she's sitting in a non-rolly chair. These kids are doing tractor safety. They're also doing sepsis, where they walk around in an escape room. But they're all, and this is, I know somebody asked me about doing things in schools, and we actually shipped out headsets so that they, at UNMC, they shipped out headsets so that they could be in the headsets doing the tractor safety event. But all right, so the next big thing is funding. Do you have funding? Yes. Woohoo! That's great. Most people do not. Usually the answer is no. So I've helped a lot of people write different kinds of grants. We're writing grants. There's so many more grants than there used to be on VR and immersive technologies. But like investments, it's interesting. I just developed a virtual reality game called XR Survive with some students at UNL in Nebraska, and I needed to pay for it because it's from my company. So I actually reached out to the Department of Economic Development in our state, and they have matching grants. And they actually asked me if I wanted more money. And they were like, oh, this isn't very much. So, they just have a lot of funding. There's a lot of state funding. So definitely look at your local state. If you're woman-owned business, which most of you are, it's worth looking at. Small business grants are fantastic. It's an easy way to work with a nonprofit or college. There's tons of like just random grants out there that are like $5,000 or $10,000, and they're just looking for a way to like help the future of tomorrow. So they're looking for, nursing help, or, there's nursing shortages, there's educator shortages. So this is a way to kind of give back to that population. Unity always has a grant that's fantastic. I know Meta has a grant right now that's like the Oculus publishing grant. I don't even know if very many people know about it. But if you want like some of those grants, that's a good thing to look up. Honestly, I've done grants.gov a lot. But like for example, we're doing a project with the University of Texas in San Antonio for their College of Dentistry. And like we looked at like dentistry grants. So there's like, grants in just Texas. There's grants all over the United States. There's worldwide grants. But always like whenever you're looking for a grant, even if it's the littlest thing like, oh, this is education for, college students. Well, it could be it could be related to someone who like, this is the first person in their family to go to college. So as long as you have those kind of students in your class, you can apply for those grants, and you can hopefully get those grants. It's the possibilities are endless. People are always like, oh, there's just not enough grants in the world, or I can't find the right grant. There are so many grants that you don't even know about and people are just giving away money. The VA, they actually helped us. Instead of giving money, they gave us laptops to help with this day, and they just let us borrow them. It was fantastic. So there's just ways around that that you can use without having to write, these giant grants. So okay, so the next thing, anyone questions right at the moment? No. Julie, how am I doing on time?
I actually do, but I can wait. You let me know what you prefer.
You can ask, but that's fine.
Yeah, just real quick. Thank you so much, by the way. Wonderful. Appreciate you. If you wanted to pitch directly to a college and you wanted to have that conversation with IT, which I do, specifically speaking to their firewall, what kinds of questions would you ask? Thank you.
Yeah. So their firewall. So that has become a question. I have that a lot. My own university has problems with that as far as like not being able to be on the hospital's Wi-Fi. So what we have done is we have added to the guest Wi-Fi. Our state has like a kind of a blanket Wi-Fi system now. But before that, a lot of schools actually, we recommend that they have 2 to 1 like hotspots. Some schools will not allow you, or schools or healthcare institutions will not allow you to be on their network, no matter what. So I've done at different places an IoT network. So having that conversation, I have had conversations with like healthcare networking groups who didn't know what IoT is, which if you don't know, it's Internet of Things. So you can have, kind of robust extras on it. So a lot of times for mannequin simulation, they have an IoT, and so that mannequin's connectivity lives on that IoT network. So we have IoT networks, and then I've partnered a couple of times with T-Mobile is very good with this. They'll let schools borrow or utilize inexpensive hotspots. I have like a Verizon hotspot. I think it's $20 a month, and it covers at least 2 headsets. So 2 headsets can connect with that. So yeah, those are the kind of things you talk about. But IoT is the recommended kind of situation for anyone who has that firewall, who doesn't want you to be on that network. I know my school has been very unfortunate with some things as far as like hacking, and so they really just don't want people to be on that network. So just creating that other network, partnering with those companies, the Verizon and the T-Mobiles, they're always looking to help educators. So it's just a very good partnership with them.
Thanks, that's a gem.
No problem. Okay, so how to get administrative buy-in. My favorite of all time. I went down to Brazos, or I had a colleague go to Brazos Sport, but we helped them with their demo day. That was probably the biggest conversational piece and helpful tool. They had a fantastic demo day. That's another thing. Any of these companies, and like if you own a company and you have software, definitely do demos. I remember like when I first started doing this, nobody did demos, and I was like, how do you expect people to buy your software? They've never been in a headset and they don't know what your software is. And I still have people who don't do them. But demo day, offer it up and say, hey, even if they have your competitors, I have competitors come and like they, take a look at their stuff and they're like, oh yeah, this is great. Or yeah, this doesn't work. And that's kind of the difference with my company is we don't have non-competes. So we work with everyone. There's some schools that will pick softwares that I don't have a partnership with, but I still recommend it. It's whatever that person needs. So definitely do demo days if you're a healthcare person and you're looking to get into this space. Provide evidence. So a lot of times we do small little pilots. That's what we did at UT in School of Dentistry. We did a small pilot. It was only about 30 students, but it proved that they were more engaged and they were more excited about learning about that process. plus any evidence that you can have that supports, what other people have done. So currently, like when we started all this long ago, there wasn't anything. I think people thought we were crazy. They were like, there's no way this is ever going to catch on. This is not going to be a thing. Now there's so many different pilot studies and so many different written journal articles out there about this, and about it actually being, an improved thing upon student populations, that it's worth it. So definitely do your research on that. If you need help, I've written a couple of journal articles. There's a bunch of them out there that are just fantastic, and it will help you with that. Especially in the healthcare world, they're really into journal articles. They really want that. Collaborate with others. Like I said, there's tons of institutions have already done this, and there's champions, and I love these people. They are fantastic. There's women and men, and anyone who's really passionate about this will help you. I haven't come across anyone who's like, well, you have to pay me. You don't. I'll help you try to get connected to these people, but definitely find a champion. And if you're a healthcare institution, definitely find a champion in your area. Like I have a couple of faculty members who are newer to their university, and they went and found somebody who was kind of interested, but then she got in the headset, and it was fantastic, and she was able to talk to their administration because she was a higher up in their facility. And so that's definitely worth it. Be transparent. Explain that it is kind of an expensive, it can be expensive, it can be affordable. Be upfront with your IT department. Make sure that they're aware of it. Make sure that the head of your IT understands that it's coming, and that you don't want to hide anything. That's the biggest mistake anyone can do. Do your research on the product itself if you're interested in something, like I said, with the demos. And then get your administrators in the headset. Absolutely. It will change the way they think. I actually worked with somebody who hated the headset, who wanted me off projects with the headset, and now she's writing grants for VR. So it's a little different. It takes some time. It's always kind of funny, how it comes around, but it's now a thing. I think she really likes it. And I don't know that I think she was just so used to learning something one way and didn't think students should learn it a different way than what she had learned it, or how she had learned it. Do your homework before you present. If you need someone to come in and help you explain it to them, let me know. I have done this a lot of times, so. Okay, so VR does save you money, especially in the healthcare world. So a lot of in-person training comes with costs that are unnecessary, or I think they're unnecessary. So you can have PPE costs or masks. So a lot of our students go through gowns. They go through disposables, is what we call them. So things that you have to throw away. So if you're doing blood draw, you have to throw, needles away, you have to throw syringes away. If you're doing IV bags, we try to reuse those, but sometimes if they have blood that's made out of pig's blood, then you spill, you have all those kind of issues that can cost money. And so this is kind of what VR training with high-end PPE costs. It comes out to $1.12 per session. Now, this is just for the headsets. It's not for software licenses and that kind of thing. But you can see 1 year is $60,000 in savings. Now, as far as high-end mannequins that move and function, they're anywhere from $150,000 to $250,000. So it's very expensive. That's for just the mannequin, not for the reoccurring costs. Whereas if you had a headset and you already had a mannequin that didn't really do anything, you could have, especially with the VR patients now, you could have that overlaying cost. Now this was based on the Quest 2 when it first came out. Now obviously Quest 3 is a little more expensive, but similar kind of savings costs. So, if you had a $250,000 mannequin, how many headsets could you potentially have? And while only 2 to 4 students can be around that mannequin at one time, and the rest of the students are sitting, back there and they're not really paying attention, you could potentially have every student in a headset. Something else that I will say, as far as like the VR for a headset, at most schools, I have had up to like 8 students in headsets at one time. It depends on your Wi-Fi. So again, talk to your IT department. Some can only, their Wi-Fi signal can only hold so many headsets at a time. So don't think you're going to have, 400 headsets running unless you've talked to your IT and you have the bandwidth to cover that. So just be aware of that. But as you can see, in 3 years, you're saving $180,000. That's 3 people's salaries, or, 2 people's in some cases, depending on where you live. But, it's something where you can maybe hire more faculty instead of having, techs do it. But it's something that it's significant cost savings in multiple years. So just as you're aware, it goes down from, 3 years, you're saving that much, so it goes to $8,000. That's just not expensive whatsoever. I have a couple of schools who are interested in looking at students buying their own headsets. So it's kind of like you have to come with a laptop. More than likely, in the future, you'll have to come with a headset as well. Now, I'm not saying that it replaces everything. It definitely does not. You still need to have those kind of in-person conversations. You definitely need to have debrief and pre-brief sessions. So, there are definitely softwares that are just, the student goes in and they take it and they do it all themselves. There's also ones that need to be faculty led. So just be aware of that as well. Okay, so technology support. As far as hardware, we're all familiar with the different software or the hardware pieces. Like I said, no need to use charging racks. Most of the schools I'm in, they end up plugging them into the wall. If you're building a space, make sure you have a lot of plugins. We've had rooms that they utilize and they're like, oh, we only have 1 plugin. I'm like, well, that doesn't quite work. So just be careful of that. And that's something that I would talk to your facilities about. You potentially get more plugins in that room. We ended up just plugging them into a surge protector and they charge overnight. Each headset has a different way to set up. Pay attention to that. Pico, whereas Meta has, it takes anywhere from 20 to 40 minutes to set up. Pico is like 5 minutes to set up. So just be aware of that. Always have extra batteries on hand unless you have a Quest Pro or something like that where you don't need batteries. Purchase the extended batteries. It's definitely worth it, especially when you have students in them for 10 hours. Now, a student isn't in it for 10 hours, but it keeps, you keep rotating students in and out. You definitely need that. Bobo VR is one of my favorite and affordable. It's the most comfortable. Quest has good ones as well, but Bobo is definitely for every headset. So I have a few. Oh, yep, we have a question. Yes. I don't know who that is.
Thanks, it's me again.
Yeah.
Really quickly, when you're having those conversations, I've been in education for 20 years, so I totally get you. When you're having those conversations with administrators, and I know that question's going to come up because I've gotten it about privacy, how do you talk about that with them in terms of setup? Thanks so much.
Yeah, so I set up a lot of Quest headsets. We actually don't set them up per student login. Most companies are not per student login. We have dummy accounts or not fake accounts, but like accounts that are like UTSA1 or, and so talking to them about how you would do that. And that is definitely in the plan that you need to come up with of how you would register those users. Most of the schools I work with have an MDM or a management company that kind of controls those headsets so that it's shut down so that there's no, any identifying information regarding related to the headsets and to the software. We try not to do that. That's not recommended whatsoever. Now, if a student has their own headset and wants to utilize their own headset at home, then that's great, but that's not something that I recommend as far as having it on campus to do different things or whatever. They could bring it, but that's on them if something breaks or whatever. But as far as privacy, I just always make sure that it's a kind of a generic email account provided either by the school or the healthcare organization. So I hope that answers that. Setting up headsets, identify the headset and controllers. I always put like little stickies on them, so like they have different colors, and then I identify them. I always, when I'm setting up headsets for any company or any school or whatever, we have like an Excel spreadsheet where we identify what the color is that's on the headset and on the controllers. And then we also identify, all of their information. So a lot of times it's Meta. So we have all of their, their QR codes and the hand controllers. We have all that information in one Excel spreadsheet that's shared with the person in charge and then myself if I'm setting them up. And we go from there. So if you say somebody breaks a hand controller for like Meta, then you can, and it's under warranty, then it's an easy way to, find or send that in or whatever and have that serial code number that you need. Most of them are on the headsets, but I've had headsets go missing. And then I'm like, I don't know where this is. And like we had a headset that actually went to Korea with a student, and they took it with them and they thought they were coming back, but it was during COVID. And we actually had Meta track it down so we could find it with the Wi-Fi. So we did find it and we did get it back. But it's always just helpful to have those kind of colors and serial numbers together. I use management software such as Arbor, Up 360. Manage is fantastic as well. I just happen to partner with these two companies. Okay. Things to consider. Another thing, cleaning headsets. So I use CleanBox. I'm partnered with them. It's a fantastic product. It saved us during COVID. We had headsets and we were still using them, and our school was like, you have to have something. And so, based on, we had VR covers. Some schools have bought VR covers for each of their students, or they make their students buy the VR cover and then they have to bring it with them and they change out the covers. They also wipe them down with Clorox or baby wipes. Make sure you do not put baby wipe or Clorox wipes on the camera or the lenses. That is a no-no. I've had burns on the camera or in the headset on their lenses. It's just been awful. Use computer lens on or lens cloths on lenses. Make sure that is lenses in the headsets and the camera, but definitely make sure they're the microfiber thing. Clean the headset between each user using the CleanBox or having a different face cover. I'm a partner with them, so that's just an option. There are others out there. That's who I partner with. Things to consider on software: figure out what courses you're going to use this in, because you might. And if you're talking to people, they might think you need it in every course. They probably don't. They probably have things already figured out. Now, if they want to build something new, that's a cool thing. Maybe talk to them about their classes and say, hey, what's something you do every day? Like, for example, for the UT dentistry, they use massagers that they like tape to people's hands to feel like it's Parkinson's and like you're moving. And that was something that we could do in VR that actually made it easier than having those kind of peripherals. So just maybe get those ideas flowing of like, oh, what could we replace that you wouldn't have to buy again, that kind of thing. If you want to build your own, make sure to find a company that can build it from scratch. A lot of companies, I've actually just had a phone call this morning with somebody who was like, I'm a developer and I don't understand why people keep going to companies that cost millions when they could be making it for like 20 to 30,000 or 20 to 50,000. And I said, I think it's just a lot in the healthcare space. A lot of people think whatever's the most expensive is the best. Not always is that true. If you're a software company and you're talking to healthcare people, the number one pet peeve that I have when I'm working with somebody is they find a software company finds out how much the grant is for, and then they think they can ballpark it like maybe if it's 2 million, they can ballpark it at 1.9 million. Most healthcare grants are not approved for that. It's like they have a line item for like maybe $100,000 for their software. They don't, just because they got a grant for $2 million does not mean that it's also paying for faculty time. It's also paying for, headsets. It's also paying for, all that kind of consultant time, that kind of stuff. So just be aware of that. Just because they get the 2 million doesn't mean they have 1.9 million to spend. Yeah.
Yeah, hi Tess.
Just a quick interrupt. It's 1 o'clock, everyone Eastern. We're coming to a close of the end. We'll give you the time to finish, but just in case anybody has to run off to a meeting, just want to make sure nobody's late. So
feel free to finish,
and those who can stick around, please do. Thank you. Please go ahead, Tess.
So networking Wi-Fi, I've kind of already hit on this. Obviously use Wi-Fi hotspots such as T-Mobile or Verizon. If you need contacts for them, let me know. We suggest 4 to 6 headsets at the same time. That just has the most bandwidth on your network. How you get students through all that is we usually do like 3 to 5 days of headset time or headset time. This can be, depending on the software, it can be done without faculty, or sometimes it has to be done with faculty. So, most applications need Wi-Fi for the record analytics or multiplayer mode. So just be aware of that if you're a campus and you're looking for software. Obviously, talk to your networking and security teams at your facility. So the right software, I have the largest list, or I think I have the largest list, pretty sure, the largest list of VR, AR, and XR solutions for just healthcare. So this includes dentistry, military, emergency services. We've partnered with a lot of different people. I originally did this for free, so this is still free. It's free to everyone in the audience. It's free to anyone who wants to post their company up here. Reach out. I just need a logo and some description of what your company does in the medical or healthcare space with education, and we can get you posted. I was tired of watching companies be behind paywalls. Especially small companies couldn't afford the paywall, and then people in the space were like, well, we don't know where to find these companies because they're stuck behind this paywall and we don't have the money to pay for it. So I just thought that was dumb. So I was a website designer back in the day, and so this is what I kind of came up with. So definitely check that out. It's at XRenegades.com. So these are just some of the companies that I partner with. These are people who are in the medical space, and they have different applications. Now, I know somebody was talking to me about K-12 education. Curio XR is actually a free platform with free software for K-12 education. So anyone with K-12 education can go and get applications from them. They are also kind of a nonprofit looking to help education build things. So if you're looking for that kind of stuff and you need something built and you're in K-12, definitely let me know and we can hook you up. That is just a guy who was interested in the space and happened to have his book sold. And so he's just helping. And that's what we're kind of getting into now is some of these companies are doing things for pro bono for K-12 education. We need to, while colleges and universities are fantastic and they're, starting to use this K-12 education, and it's also, hurting, and they don't have lots of money either. And so we want to make sure that our students are coming up through there and getting, the same kind of education in VR. So these are just some of the companies you can take a look at on the site. I have VR hardware solutions, so I do a lot of these setups, make sure, they're high-powered VR headsets. Some people I've come across are like, oh, we bought these headsets, and they're like from Walmart, and you put your phone in them, and then we bought this software, and it's for Meta. What do we do? And I'm like, well, you have to have the headset that matches the software. So just be aware of that, because people have been confused. I had an entire university who bought a software that thought it was for web, and it was not. It was for headset only, and it was only for Meta headsets. So just be very aware, because then they had to find funding for that. So just be aware, make sure you're cognizant, ask what you need, don't assume that they have stuff. So these are the colleges and universities that I've kind of worked with in the past, and I know people who are doing fantastic work at. So Georgia and Parker are colleges that Mary Lee and Rob Therout at Georgia and Mary Lee at Parker, they are fantastic. They know exactly what they're doing. They've built their own labs. They understand VR very well. They are always, always, always willing to help you. So if you're somebody in that space and you need help, definitely let me know and we can hook you up. I was the College of Nursing at Ohio State. I'm currently working with UT San Antonio Dentistry and Nursing. In the past, I've worked for Brazos Sport and a Nebraska Medical Center at College of Nursing. That College of Nursing, we have developed Nurses Escape, Roller Ranch, Nurses Escape, Part of the Problem, and then we have another one on heart health, and then XR Survive is my current project for active shooter situations for K-12 students. So lessons learned, and I don't know if Julie will have these, but Wi-Fi connection is important. Be kind to your technologists, even if you are frustrated with them, be kind. They are probably learning alongside you. If they don't already know or they don't have something at home, it's also very much a lot of work for them. Get networking on your team, get your sim techs on your team. Make sure the beds in your simulation rooms are easily movable. You can do this for little or no budget. You can get a headset, a Meta Quest 2 right now for $200. I mean, it's very simple, and there are a lot of free applications out there. Ask for help from this community. XR Women is a fantastic community to be in. They can help you, or I can help you. It does not replace regular simulation or clinicals, just to make that very clear. It's just an added way to learn. Oops, sorry. Network through other organizations as well. I have a LinkedIn network for XRenegades and VR AR in health care. VR ARA, IVRHA is fantastic. And some of these are things that you can belong to, and you can go to some of their sessions without actually paying for. I know the LinkedIn community, that's how I kind of found questions to answers, was on VR ARA. On their LinkedIn community, I didn't pay for it. I just asked a question. I had an answer in 30 seconds. And it was something I didn't know. So that was a very interesting thing. Demo at least 5 or more softwares. Most expensive doesn't mean better. Demo different headsets if possible. A lot of these companies will send you a demo headset. I know Cleanbox will send you a demo Cleanbox. Let me know if you need that. Hire a consultant or coach if you don't have time. Now, if you have massive amounts of time, it's very easy to find on the internet. If you need something to get started, let me know, and we can kind of go from there. A lot of consultants are pretty inexpensive in this space compared to what it used to be. Headsets take time to get set up. I just recently went to a high school, and there was, we spent the whole day setting up 15 headsets. But I wanted to make sure that they understood how to set them up, so if something went wrong, that they could fix it. Suggest management software. I think that's the easiest. And so if you have any questions, thank you again for having me. I'm super excited to be here. And it was fun, and I hope you learned something. And if you have questions, let me know.